as humans, right, we have such a deep history of using our bodies more than we do now in our very kind of heady culture. I'm kind of overgeneralizing here, but we come from roots of moving together, dancing together.
Welcome to the Holistic Counseling Podcast, Kim.
Thank you so much. Thanks for having me on, Chris. It's great to be here.
Yeah. Can we start with what first interested you in a somatic approach to therapy?
So I, as a therapist, arrived through the body, we might say. So I'm a dancer first, and I came there and found counseling that way. So the only way I know therapy and counseling actually is with a somatic approach. So as I mentioned, I was a dancer, and then coming out of college, looking to see what my path was going to be. And I read an article about dance movement therapy. So that's what I went to grad school for. So all of my training has been completely embodied and completely from a soma, a body perspective. Yeah. And so the psychology piece for me, the counseling pieces are really on top of the body knowledge. So I think, yeah, those of us who came from that direction, we've got
That's so interesting.
really baked in. Yeah, exactly. And
Yeah.
so it's great that everyone's more on board now because
yeah,
when I was in
no,
grad
isn't it
school,
awesome?
yeah, it's really, really great because that's what we've been swimming in and that's what we've been doing. That's what we've been practicing. And it's so much more popular and so many more therapists and people are interested in. So it's a wonderful, wonderful time to be
For
a
sure.
counselor.
I
And
love
how
seeing that shift from traditional talk therapy to more holistic realms and using the body more. Because I think the more and more we learn about the brain and trauma, the more we have to include the body in those trauma
Exactly.
sessions. Oh, my Lord.
Right, exactly. And this is where it's where we come from, right? As my kind of personal journey, but as humans, right, we have such a deep history of using our bodies more than we do now in our very kind of heady culture. I'm kind of overgeneralizing here, but we come from roots of moving together, dancing together, right, playing
That's
music
true.
together,
Mhm.
and that's before there was traditional therapy, we healed in all of these ways. So to me, it's sort of reclaiming and redesigning almost, how we use these parts again that are very sort of innately human and bringing them to a modern perspective.
Yeah. So, how would you describe what is somatic therapy as opposed to traditional approaches? Because some listeners may not be familiar with what we're talking about.
Yeah, well, I always like to distinguish too that you mentioned the therapy piece that there is somatics and there's body oriented approaches in therapy, like psychotherapy. And then there are also the body approaches that don't have that psychological counseling component. So that's sort of the first thing that I know I'm often like clearing up with people in these conversations, or even when clients come in for services, right? So they may be getting some other type of energy work, or they may be getting massage therapy, and there's so many other things, and those can have psychological benefits, but that those are different than when we're combining counseling or therapy with the body. So
No, I
um
appreciate that distinction.
yeah, I think I that's one that I repeat like again and again and again because yeah, I mean you and I, we do this all the time, but for people who don't, I think it's a good reminder and just kind of separating out these circles almost like a Venn diagram, like where they overlap and where they're separate. So for me, I also love that it can be sort of all encompassing, and depending on how a therapist was trained, they may be bringing different things in, even if they're all kind of using terms like holistic, or even they're using somatic therapy. So for me, it really is about using the body in some way. And then, for example, if you're looking for a therapist or you're looking to work with a therapist or getting trained from another therapist, you want to see where they're coming from, basically, right? And seeing if that aligns. So I know as a therapist, my therapy website, outlines again sort of my origins, right? I'm coming from this dance movement therapy place. I also do EMDR. I consider that under this umbrella of somatic therapy, right? We're incorporating and we're paying attention to the body in therapy. And, how we use it is again going to be a little different depending on, what a therapist has been trained in. But it's really about, that body approach.
What kind of therapeutic somatic interventions do you like to use with clients?
Yeah. So I would say that always at the front for me, I'm always looking in every session to have some connection with movement and with body sensations. Now, it's not necessarily in that order. It's really depends on who the client is in front of me. But when I say movement, the range of what that can be is very, very large. So that can be noticing what gestures, so I'm kind of moving my fingers forward right now, can be, is somebody talking with their hands, or are they making a gesture as they talk about something that's really difficult, or there's something they're really excited about. And that's all the way, in my case, I do use dance at times in my individual therapy sessions.
Which
So
is
even
amazing, I had
yeah,
to say.
yeah, it's really fun. It's really exciting. And I'm just there to honor, right, wherever a client is, right, on this really big spectrum of really small movements. So, I mean, even some, it could be a change, a very subtle change in their body posture. But I'm always at least calling attention to, or we're doing more interventions that come from some sense of movement. So that's always key for me. So because even though I come from this place, it can get really easy to get sucked into the verbal aspect, right? And that's usually where we're used to really connecting with people. So that, it's just always present for me. So that's what we're doing. And sometimes it's easier than others to really pull
Of
that
course. Yeah.
in, but we're always doing that. And so the other thing is just identifying body sensations. And that's really developed for me over the years. I think as the years have gone on, noticing that it's just a skill that needs to be built for most of us, I would say. And this is how we bring the body and mind together, is what the heck am I feeling? And can I put words to that? So here's where these two things really get combined. So, that could be, it depends on the client, whether I'll start with more exteroception, paying attention to the outside, or the interoception. So I have to assess, where they're at. But, can you feel yourself sitting in the chair? That's a really common one that I use. Are we focusing on that, where that contact is, that exteroception? So it could be identifying how it feels on the outside, or using the senses. That can also be, what does a client see in the room? Can we identify something that is pleasant, a color that they like, a shadow from the window, a light that's streaming in? Can we name that? And then including in there the interoception. How does that feel on the inside? So the visceral organs, including, the heartbeat and the breath, but also what are those little things that we are feeling, those shifts? And that can be just how they arrived, or that can be, again, I saw that beam of light come in from the window. So then I felt a little bit of lightness in the body. Again, can I name that? Can I name that lift? Can I name that lightness? So again, tying those things together with the words. And I know just there's a lot more research being done about this and how that can really help, especially I think anxiety has really been researched a lot. When we know these things about ourselves, we have to know where we are, right? This is how we know where we are. So that helps us know where we want to go. So those are those two kind of basic paths, sort of big umbrellas, I would say, that I'm always looking at when I'm in session. And then again, it's really, really tailored to who's in front of me and what we're doing. But that's how the body is. There's lots of directions we can go, but the body is always present in those ways. And when I conduct,
the body's always present. And I know with brain spotting, a lot of times too, when they're processing and something comes up, you often check into the body. So just notice that. Where's
yeah,
that coming from? Just feel it, be with it,
yep,
allowing.
exactly.
I don't know. EMDR is a little different, I know, because we kind of have that fixed eye position, but it
Yeah,
just, I
good.
feel like this can transform how you are as a therapist too, just to even
Yes.
allow that and just checking in. So if they bring up something in session, I often will do this too. Just be like, let's just sit with that for a moment. Because a lot of times clients just want to go on and on and on and on and not
Exactly.
pause, but let's slow
Right.
down. Let's go back. Let's
Right.
notice. Do you think it is slowing down too with somatic approaches? And
I do. Yeah. Yeah, I absolutely do. Or one thing, I have different phrases that I use for like the kind of verbal running away. And sometimes I use
you
it in a
said
running.
verbal running away. When
Yeah.
is
Like,
that when clients keep talking and talking? I
yes.
got you.
Yes. And or this sort of verbal run. And so, yeah, I agree. There is a slowing down. So, quite literally, there can be a slowing down in
Mm-hmm.
words. And then it's also slowing down in content, right? Whatever content
Mm-hmm.
that we are working with. And right, what we can be not wanting to feel or get in touch with, of course, right, is what's going on under here, right? And so that's a skill that just so many people develop, so we don't have to feel and like, whatever that trigger is, being aware of the body sensations. But to your point of, yeah, let's check in with that, let's see what's going on there, right? That's an experience, that's a skill that, I mean, most of the people who walk into my office, that's a skill that needs to be built. I mean, I know there's certain areas of my life where I
Yeah, and
still
it
work
can
on
feel
that.
foreign for them because they're not used to that.
Yes, right, exactly. So yeah, I would definitely say it's a slowing down. And then of course, I'm sure you experience that too, right? That little bit of titrating sometimes of like, well, what
Mhm.
can they handle, right? And we're really paying attention to
Yeah.
see, what they can tolerate within the body. Right. So we're using all of our skills and our mirroring, right, and all that, paying attention to see, right, because some can't tolerate very much of that. So the verbal run might start again, right, and you might have a little bit of a start and a stop, right. So just really watching for that, right. I think that's some of that kind of trauma informed and just kind of safety approach of just slowly increasing their capacity to really be with.
Yeah. Yeah, increasing that window of tolerance and
Mhm. Yep. Yep.
so they can, I always say pushing the edge too. So sometimes it's hard to know where that is, but we do have to. And that's sometimes with yoga, we can do that too. If we do a
Yes.
side stretch, let's just stay there a little longer than you're used to and see
Yes.
what comes up and
Yes. Yep.
notice, right? That distress tolerance. So it's
Yeah,
all
exactly.
interconnected.
Right. Yeah. I just came out of a session. And so one thing for me too, it's really big, is using a client's own movement, right?
Yes.
And
Hmm.
assessing, where to do that and where to, like you said, maybe have a specific intervention, like yoga is a good example of that. But we were in this last session, we were coordinating the breath. It was the client's own movement, and they were a collaborator in this. We were kind of
Mm.
shifting the weight and going into the body and expanding the breath, because the breath didn't feel good. It was really shallow for them. So we were expanding that. Yeah, I made her do it again, to your point of
Yes.
that
Hmm.
edge, right? And like, I could sort of feel from them. And this was even in a telehealth session. We could have gone on, but I was like, all right, we're going to do this again. And we could deepen the process, right, by repeating
Yes.
it
Hmm.
and, right, slowing that process of the session. So, yeah, to me, that was an edge that we kind of pushed up against. And in this case, right, again, we don't really know. I was watching the cues, watching the signals, and
Mm.
it was a helpful thing to do, right? We expanded that again, and the client could tolerate that and got a lot out of it, and we could do some processing from there. But yeah, finding that edge is always.
Yeah. So I was wondering what you thought about this. So, what role does a therapist's own embodiment and presence play in facilitating these somatic interventions?
To me, it's everything. It's absolutely
Agreed.
everything. Yeah, we're totally on the same page there.
Yes. Mm.
And I get, and again, this is maybe through the lens of clients sometimes, but I would say, so people at this point, people come to me specifically to work in the body. So if they're showing up right in session with me, like that's what they're there for. That wasn't always the case, working in community mental health and whatever. But at this point, that's where it is. So I will hear sometimes, oh, my therapist just told me to do a body scan, or they just kind of did a body scan, but then they didn't know what to do after it. And so, I get the sense that sometimes, at least from the therapist point or the client's point of view, they're having this experience of like, therapist is trying it on, right? We have a general knowledge, this more of like, these things are good for us. But I can tell, especially when I hear those stories, right, that the therapist isn't yet comfortable. And then, I'll never meet this, I'll never know who that therapist is, maybe, or whatever. But I wonder about that. That's always my first question. I'm like, I wonder how often they've done it themselves, or I wonder, how often they've practiced
Hmm.
it. And so for me, as I work with therapists now, like that's a huge foundation of it, is just having the experience yourself, right? You have to know how that feels like in your own body, both if you're doing specific interventions, right? Having them tried it before, or at least been close enough, right, to something that in your own body. And then also having your own body awareness before, during, and after, right? Were you facilitating
Yep.
while you're
Hmm.
facilitating the session, right? To know what's yours, or what's the client's, or if you're not sure, right? And having that experience of, we talk about journaling content, what's coming up for
Hmm.
me if we get triggered, but we get triggered on a body level as well. So feeling that out and being aware where we are in space, what shapes are we making? What are we doing with our tone? Right? It's all just as important as the words. So yeah. So if in general, right, it's important, but especially when we're bringing in anything that has to do with the body, it becomes extra important because we're modeling it right at that point. And if we're not really comfortable, that's what the client is going to take away. So, I think it's important for all therapists, but it's especially important if we're saying we're doing anything, even if it's
Right.
breathing, right? So that's even more common.
Yes.
And if you had mentioned to me that you're starting there, and I'll hear like, oh, a CBT therapist does it, and that's great. And that's a point of reflection, I think, right? Like, do I know it's as a therapist, do I know what's happening in my own body as it's going on? And have I tried it
Right.
on in my
Hmm.
own body to know how
Yeah.
it sits for me and how, right, we can only have our experience, but how might it show up? How might the body respond, right, if we do an intervention like this?
Yeah, that's why I teach therapists how to use yoga in sessions clinically. And that's the
Mhm.
first thing I tell them. You have to have your own yoga practice,
Yes.
movement practice. You must move. You must get comfortable in your body.
Yes. Yep. 1,000% agree.
Yeah, totally on the same page, aren't we?
Yes. Love it.
So, what do you say to clients who initially are referred to you? How do you explain what somatic therapy is? Is there a way that you present it to them so they can understand? And
Yeah, I think it's no small thing. It may seem a little extra to your question, but at this point, I feel like my website is really, really clear. And so even if I'm just so either therapists that I network with or people reach out to me, that's sort of my base. And I think that's a really
Mhm.
nice way to start since I've had like a really clear website. It's a really good foundation. I even have a video on there, and that's more about explaining dance movement therapy. But just the introduction, right? Just getting some kind of introduction of what this might be. So there, I kind of break it out. I talk about dance movement therapy, and then I talk about somatic therapy, and I talk about EMDR. I talk about expressive therapy as well because that's part of what comes in. So I'll say that is that I let them, if it makes sense and how we've connected, that they sit with some of that material themselves. And again, I think that's important because this is becoming more common, but that's still not the norm, I guess I would say. So I like them to
Right.
have that
Mhm.
space to kind of digest some of that so that they can come at me with questions. And then usually by the time I'm speaking with them, say on the phone, they want a clear example of what it looks like, which makes a lot of sense, right? So they have
Mm.
some reference, they've either been to my website, they've done some research, but now they want to know what it looks like. So similarly to what I was saying to you earlier, I emphasize that for me, it's really individual, right? It's based on what they're coming in with. And then I emphasize a lot of pieces again that we've kind of talked about, which is that we're going to bring in the body. And I mean, just similar to the ways I think that actually we talked about before, I
Yeah.
sort of give
Mhm.
some examples. I like to use, and again, my theme is tailored to the person. I like to use what they've said. Like
Mm.
if they fill the form on my website, like give me a really short piece on what you're working on. And I like to tailor it to what they've said, that they're the reason they're coming in, right? So if it's anxiety, if it's trauma, if they've given, it's a childhood trauma, right? Like, okay, so an example could be, if we're talking about childhood trauma,
Right.
we
Mm.
might be looking and seeing how that's still lingering in the body, right? How is that showing up in your movements, right? Your movement quality, right? What kind of responses are you having? Are you having flashbacks? Are you getting triggered? So I'm going really specific. So this is maybe a little off from the question that you asked,
Oh,
but
no. Yes.
that's
Keep
how
going.
I
Yeah.
I really kind of zone in, I guess I would say, and try to speak to them. Again, because that's how I work, and speak to, well, if you're coming in with this and this is what you've told me, and by that time they probably already told me a little
For
bit more on
sure.
the
Yeah.
phone, and so it's confidential at that point. And yet, so part of that reason is I'm trying to offer a little bit of education and get them
Mm.
comfortable, right, with this idea. And so I'll start with, I'm making sure I'm offering a range too, again, of things that we might do. And I'm trying to gauge, because again, I'm going to speak broadly, like maybe kind of white culturally, right? There's just so much there's fear, but there's also just discomfort, right, around the body. So I'm
Sure.
just trying to very gently just introduce ideas, right, of ways that we're going to sort of get in touch with it. So again, if they say they've done massage or energy work or yoga, right, or any of those things, I'm trying to use those and use their foundation and connect, right, somatic pieces, connect it to what they might already know and have experience with. Yeah. So that's how I approach
Yeah,
it.
that makes a lot of sense, though. And I love how you said using their own words too. So I would think that would help them to really stay more tuned into what you're saying if you're almost reflecting
Right.
back in the ways that
Right.
they're speaking. Yeah.
Right, right. Because I think that's what's on us, as either somatic practitioners or holistic practitioners is I think that education piece. I mean, it's true for all therapy, but again, we have this extra body component that is less. The word fear just keeps coming up, right? We're just more
Mm,
fearful of that, or you really kind of more fall into the like heady mind thinking stuff. So, right from the beginning, when we meet someone, I feel like just kind of laying down an inviting path, right? Just kind of like rolling out a course for
mm,
them. Like, here's what we could
yeah.
do, and here's why it's going to be helpful, and also maybe not so bad, right? Like
Exactly.
offering,
Take some of the fear out of it, maybe too.
yeah, offering, yeah, really
Mm,
a new relationship. I
that's
mean, hopefully,
true.
obviously to themselves, but really a new relationship to their body. I mean, yeah, I'm not sure about you, Chris, but I mean, the more I do this, right, like that is just true, right? Again
It
and again
is.
and again.
Mm-hmm.
And then I hear it in different versions, right? Well, I've done this or I've done yoga, but then like a client will say, I've done yoga, but then this part is still stuck, right? Or it's showing up
Sure.
in this
Mm-hmm.
chronic pain, or it's showing up in this way, right? So just kind of leading a path of just continuing to really connect and learn to love and be
Mm.
in the body.
Yeah. Have you encountered some difficulties with integrating with some people? Have there been some challenges?
Yeah, I mean, I would say, yeah, I'm thinking an example comes to mind. And again, this is even in my practice as it's been for the past couple years. This is what I call myself, and this is what I tell everybody I do. And
Mm-hmm.
sometimes I do get people. So I was mentioning body sensations and learning to identify those and name those, and some of the exteroception as well. And yeah, some people they still get really uncomfortable with that, and yeah, they can still try to shift again, even though maybe it sounded good on the phone, right? We had that
Right.
initial
Mm-hmm.
consultation, right? And so for me, where I come from, that's where I will then maybe tap into more of the umbrella of the expressive therapy resources, I would say,
Mm-hmm.
because I find that can then be the inroad.
So, what do you say expressive therapy? Is that like through
Yeah, so
dance or?
sometimes that's more of the like art materials, like bringing
Oh,
in art
art. Okay. Oh,
materials or
I
bringing
see.
in music
That makes sense.
and the sensory qualities with that. Right. So the express theory is a big umbrella, but sort of layering in, even though I lead with the body, most people don't think of the art piece of it. But again, that's an opportunity where I'm like, okay, well let's try this. Or another way is using images. Again, this kind of branches out into that maybe holistic or expressive umbrella, or bringing in images. Like I have an image card deck. So I'm looking to tap into, and this is something I talk to therapists about, right? The imagination, right? So I'm looking for other ways that feel safer. If like going right to the body, if I'm getting these signals of like, no, I don't want to talk about that, or I already know, or I already did this, I already did yoga today. Like, no, I already know what I'm feeling in my body, right? I'm looking for these other inroads. So under this sort of expressive umbrella, imagination, another type of sensory experience. So I'm thinking of, in my practice example, client maybe who would draw things out. We had a theme of a shape, and I had this client sort of draw things out. We had different like phases of their life, and we're putting things down on paper. And so literally, right, there's that sensory, and it's a body experience, of course, right, of making
And in a
contact.
way, it's movement.
It is. You are exactly right. It is a
So for
1,000%
painting,
movement. Yes,
yes,
right. But I may not label it as such, right? In the beginning.
exactly. No,
Yeah,
yeah.
right. Exactly. So, right, we're coming at it from a different angle, right? We're not coming at it
Mm,
head on,
okay.
right? We're coming from another side.
Side
Um
door.
yeah, right, exactly. Which is totally great, right? It is totally
Mm-hmm.
fine. This
It's
is where we
amazing.
build our skills, right? Exactly. So yeah, so again, it's totally fine. Just okay, then we're going in a different direction. And yeah, just playing around and seeing what sticks. And yeah, it can be really, really fruitful.
So, can you share a story of some success you've had with using somatic interventions?
Oh, yes. Where do we start? So many. I will, let's see. Let's start with. So I mentioned earlier that a big focus that I have, the way my approach has developed over the years, is zoning into a client's own movement. I have a client in mind. I'll call this client Wanda for the sake of our conversation here. So Wanda had a lot of childhood trauma, and this was a client I had over telehealth. So I know sometimes there's questions about, can we do this stuff
Yes.
over telehealth?
Hmm.
And so this client in particular did very well over telehealth, distance wise, just schedule wise. That worked better for them, and it worked well overall. So this client was open to movement. Again, they came, and again, we went more of a front door approach. We were talking about side door, front door, and they were very open to it. But so often it was very accessible for this client to stand. So we would adjust our cameras. It would just really invite this client to stand. And often we would start almost like a little bit of a warm up. And oftentimes, sometimes a warm up can be more formal, sort of coming from a dance movement therapy approach. But I tend to really watch and encourage what a client's own movements are. And again, that you have to see who you're with. But this client was very open to that and would just stand up. And of course, they were at their desk. This is a client who also had a job where they were often at their desk, staring at a screen most of the day. And they were open to that shift. So through this process, so just about every session, right, we would start with that process of just how does your body want to move? And I would follow along, right? So they could see me if they wanted to look up, they could see me mirroring them. Sometimes I would do my own things. Sometimes I would try on things that they wanted to do. And I would just encourage and just reflect back what they were doing and really just support the like, yes, okay, great. Like your shoulders need to move, yet really feel how that goes. And sometimes I would offer, if you want to, you could vary the size of that. You could vary the speed of that. So also looking for those opportunities to see if the pattern wanted to change, right? Sometimes we just do these things and it's somewhat automatic, even if we're paying attention. So throwing out these invitations, right, to change it up. So over the course, so this again worked very well for this client. So what we were able to do over the course of weeks and months off of this very natural movement that this client had, we would then tap into that when we were talking about memories. So here, this movement was allowing this client to finish movement patterns that didn't get finished, right, during the traumatic events, right, of their childhood. So starting with that warm up from the beginning, we could use that quality when, say, there was maybe a lot of closing in, right, of the body if we refer to a specific trauma. And so then because I already had the experience and it was part of our routine to ask where the body wanted to go, right, when she'd revisit this memory or even a trigger, right? And we didn't necessarily have to get into the depth of the memory, but simply tapping into, well, where does your body want to go next? Do you know? And it's okay if you don't know. This client was able to say, for example, maybe, yeah, my shoulders want to move. And then I want to leave, right? And then I want to step away. Okay. And then what does your body want to go next? Okay. Then my body wants to curl up in the ground, right? I want to cry. And this is over several weeks. This is over several sessions. Okay. It wants to curl up. It wants to cry. Okay. Allow it, right? And then the allowing is a huge part of that. All right. Allow it. Okay. Where does your body want to go next? And we'd have some connection, right? The body would want to connect, want to move, or she'd want to say something. And so we do that. And where does your body want to go next? And because this particular rhythm of working worked well for this client, we really used it to revisit that trauma, both as it was in the past, but as it happened in the present, right? Or how she got triggered and repeat, a pattern where it would get stuck, in the present. And so what happened for this client is, the past haunted her much less. The present, she felt more accessible in the present to choose other patterns, where she might be repeating this in some way, shape, or form. So she could choose other things. And sometimes she didn't, and that was okay. She'd bring it in and then we'd revisit it. And again, we'd come back to the body. But this client in particular, really, again, that specific approach really worked. Again, sort of that front door somatic approach, and specifically, where does your body want to go?
Well, that's huge then it sounds like too, if they were able to tune in more and be able to, "Oh, wow, my shoulders do wanna move. I do wanna stand up." And
Yes.
trust it's like, I guess this is a level of trusting yourself too and your body and what's coming up and
Yeah, yeah, absolutely. And obviously, as therapists, we talk about trust a lot. And we built a bond very early, and so we could build
Yeah,
that trust
exactly.
interpersonally as well. So yeah, it was in the body, and then of course using that therapeutic approach, to do that. So
Because I think not all clients would have that capacity.
yeah, it's true. Yeah, not all clients do. I
Yeah.
would
Mm.
say, yeah, where I'm at now, I get a lot more of that, where they do have
Yeah,
that
that's
capacity,
true.
or it may
Mhm.
take longer, right, to get there, which is
Exactly.
totally, of course,
Mhm.
totally, or it may happen in a slower way or in smaller ways.
But it sounds like it can be a gradual process, but you really tailor it to based on what the client needs and where they are, I think, too, because we can't cookie cutter
Right.
this. It's gonna be different for
Yeah.
everybody, and if
Yeah.
I were to say even some of my clients I've had long term, have good relationships with, "How would your body like to move now?" They would be like, "Oh, I don't know." Shrug my
Right.
shoulders. I
Right.
don't know.
Exactly. Right. Right. And
Like,
that's
just some
why.
are just not more into even if we've practiced and we've done yoga and
Right.
other things, just it is more difficult, I think, with some people for sure. But then you have
Yep.
that green light moment when a client is in tune and it just goes splendidly well and they're
Yep.
able to
Yep.
connect. Yeah.
Yep. Yep. Exactly.
So, what would you like to tell listeners who may be wanting to move into the somatic realm of therapy, but they're a little bit hesitant? What kind of advice would you give them?
Yeah. And are we talking about therapists or clients?
Yes, therapists. Yeah.
Therapists. Yeah, I would say, to your point that we were talking about earlier, is to find a somatic practice of your own first, and that's really wide. The
Yes. Mm.
spectrum is really wide. Obviously, yoga is very popular, but it doesn't have to be yoga. If you used to take dance classes and want to get back to dance, or you're interested in tai chi or qigong, I would include breath work, in that, whatever that is, right? That net is really wide to really find what speaks to you. I mean, I would even include, if you like to walk in the forest, whatever that is, but with the intention of, getting in touch with the body. I guess that's the focus, and to connect with it. And I guess that can be different, right? We can do yoga for different reasons, but really see what your framing is around knowing your own body and having experiences in your own body. And then from there, really getting the training, consultation, supervision around learning it, and having the experience of how this might show up, right? How you might bring it in to therapy. And so you mentioned, you do that, Chris, and so I do that, and just finding the teacher, the practitioner, the educator that really resonates with you. And again, I think where we're at now, there are so many beautiful options. And decide, like I teach therapists more like at the beginning of the journey, like maybe they've done some EMDR and they're like, wait, how am I going to do that body stuff in session? So they
Right.
can, they come to me and we can really flesh that out and really help them get comfortable with how to do that.
Yeah. Mhm.
And then that would be fine, right? And so then you're there and you've got these new skills. And then some people want to keep going. I'm sure you have too. I've met therapists all along that their journey, right? And they're like, oh, well, now I want a certification. I've done this, or I did an online
Yeah.
course, or I just did
Mhm.
this. And so there's really a lot. There's a lot to choose from. But yeah, being curious yourself about how you're going to be in your own body, move in your own body, and then looking for ways. There's so much out there just to
There
learn
is, yeah.
what captures you, right? Like,
Right. Where do you
don't.
find that light, that passion?
Exactly. Yeah, don't worry about whatever everyone else is doing, right? Find the direction that you connect with.
Yeah, thanks for that. So what's the best way for listeners to find you and learn more about you?
So I have a website. It's kimbevans.com, KIMBEVANS.com. And so I have some freebies there. And so one I have now is my top 6 somatic interventions. And so that's a list. There's a quick reference guide of things that I always use in session. So they're just referenced there. Sometimes I'm looking to just refresh of like, oh yeah, what can I do? So that first page is really just sort of that inspirational page. And then the PDF has links to audio examples and video examples. So if you want to take that a little deeper, again, get some inspiration, it's there. So I have the freebie on there, and also description of the course that I do for my embodied work. So that's at kimbevans.com.
And we'll have that in the show notes, listeners. So if you are listening in the car, make sure you can go to the website when you're on land and find it on there. But thank you so much for coming on the podcast, Kim.
Thank you, Chris. This has been really wonderful.
And thank you, listeners, for tuning in today. I have a question for you. Are you struggling with feelings of burnout and emotional exhaustion in your counseling practice? Do you always put others first? Discover more balance with my new workbook, The Self-Care for the Counselor, a workbook. I can't talk today. Take 2. The Self-Care for the Counselor, a companion workbook. This workbook helps provide simple strategies that are not only practical, but easy to integrate into your busy life. Go to hcpodcast.org/workbook. That's hcpodcast.org/workbook. And once again, this is Chris McDonald sending each one of you much light and love. Till next time, take care. Thanks for listening. The information in this podcast is for general educational purposes only, and it is given with the understanding that neither the host, the publisher, or the guests are giving legal, financial, counseling, or any other kind of professional advice. If you need a professional, please find the right one for you. The Holistic Counseling Podcast is proudly part of the Sightcraft Network.